What decision-making frameworks or mental checklists do you use when planning high-risk or rare surgeries?
One way of looking at it is to go through the imaging, go through the CT scan, go through the MRIs. What I like to do is I draw, suppose it's a vascular case, aneurysm case. I draw the pictures of the angiogram
On a sheet of
on a
paper?
sheet of paper.
How it helps?
It helps to give you a perspective of how everything is located, the blood vessel in relation to the normal brain, and you play on these pictures in your mind. If you have an angiogram, you can rotate the images using the software that we have. Suppose you have a tumor, you can rotate it in various directions once you feed it to the computer. Using that, you analyze and see which is the best approach, which is the safest, the shortest approach to where you want to go. At the same time, what I always do is, suppose it's a rare case, suppose it's a difficult case which we don't handle very often, I usually play videos of previous surgeries which are similar surgeries, and so you kind of refresh your mind on how things are and how things should go, because when you operate under the microscope, everything is recorded. Like you edit your presentations, podcast, we edit our operative videos because operations go on for 5-6 hours. You can't store everything. Now everything is under HD, and you have special recording systems which can record in 3D. You can watch the video in 3D as a post process.
Is it always the case where you have to draw, or sometimes the case of emergency where this time is very limited, you have to get into the surgery, right? There's no time for drawing.
For trauma, especially like for bleeds like extradural hematomas, acute subdural hematomas, you just look at the scan and go in. But when you have to plan surgeries like aneurysms, arteriovenous malformations, vascular supply to the spine, vascular lesions of the spine, tumors in deep-seated locations, then you have time to
It's better to plan and
go in. Now with the DSAs which we do for the brain supply, blood supply, we have a vascular 3D. We can rotate it in 360 degrees, study the entire vessel, study where the aneurysm is, what is the size of the aneurysm, where it is projecting, which side it is directed, what is the size of the root of the aneurysm. Everything can be studied. So that gives you a very good picture.
That's quite interesting. I never knew like surgeons playing their own videos to get better.
It's very important for surgeons, whichever the specialty, if they can record their own videos, especially when they had some problem during the surgery. Go through those videos, see what went wrong.
So have you crossed over 10,000 watch hours watching your own videos?
not so. Not much, as I try to walk 10,000 steps every day, but not even watch hours.